Thank you very much for having me. I'm Dr. Jen Dyer. What I'm going to do is take you on my journey of putting mobile health in action and practice. So here we go. So to start off, I'm a pediatric endocrinologist. This is me with my little patient, PJ. He's at 15 months old, he was diagnosed with type 1 diabetes. And here he's a thriving 5-year-old who was honored at a patient induction ceremony for special patients and their stories. I'm also approaching mobile health as a health behavioralist. I have a master's in public health and really try to approach behavior change and motivation with that knowledge. And really, I'm a problem-solving technology entrepreneur. And really, I learned that in medical school, how to solve problems and fix things for my patients. And I'm also a social media enthusiast. Everybody calls their diabetes doctor their endo in the States. And a little girl called me Endo Goddess, so that's kind of how I got the name. So to start with, in 2007, for my public health thesis project, wrote online, and that was my first online social experience about really trying to improve health literacy. That was the objective. And what I really found is that it's a very powerful way to help improve health literacy. And it just makes a lot of sense because 83% of adults are actually searching for information online, and I would be willing to bet that parents are a higher number. And in fact, searching for information online affects patient outcomes and treatments and the treatment decision. And when you look at the prism of trust, a doctor tends to be somebody in general that most of the time people trust. So it made a lot of sense to me to be involved in social media in order to help with health literacy. So in 2009, I started on Twitter and called myself Endo Goddess, like my patient had called me. And really the objective and strategy behind being on Twitter was to help with health literacy. I'm the only doctor in my family, and if any of you are the only doctors in your family, then you're always asked the same questions particularly about headlines. What's this H1N1 and do I have diabetes, or, lots of information. On the first day of medical school, my mom asked me, it hurts when I do this. So I just said, don't do that. But basically, Twitter for me and social media is my way of kind of putting all that information into one form so I don't have to say it so many millions of times. And I wasn't born knowing how to make apps. I'm a very amateur programmer. I was a pretty nerdy kid that I used to like to program Pong games for contests. But it was only 2009 that's the first time I ever bought an app or knew anything about an app. But in 2010, a medical student and I made an app together, just reading very basic books about coding, and we made an app to automate a research protocol that I did that I'll tell you about. And then in 2011, the Endo Goddess App was released with real programmers and a different concept for behavior modification, which I'll also tell you about. But just as background, in pediatric endocrinology or pediatric diabetes, most all of our patients, whether they have type 2 diabetes or type 1, they all are pretty much on insulin. So we typically have our patients check their blood sugars 4 times a day. And even when they're on an insulin pump, an ACT button to press for boluses is actually what we ask them to do. And boluses are prandial boluses whenever you eat, and then there's a basal amount of insulin. And what happens with a lot of kids is that they don't press that button. So even though it's relatively easy to press that button, I actually knew that they weren't pressing that button because They would download their pump to CareLink software, and then they would also download their glucose meter, and I would be able to look at it, and I could tell, and I blurred out for patient privacy all the information, but I can tell every time they didn't press that button. And a lot of the barriers to why they wouldn't press that button is it's actually pretty complex. Sometimes it just has to do with financial reasons. A lot of kids are actually worried about their parents when they lose their jobs. They're worried that if they press the button that they're going to have more insulin, that their parents can't afford it, and that they're going to be causing all these fights. There's also eating disorder called diabulimia, where you specifically don't press the button so you can lose weight and be catabolic. There are also adjustment disorder to having a chronic disease, depression reasons, forgetfulness, fear of low blood sugar. So there are a lot of reasons. But it made sense to me when my teenage patients were texting in their office visits with me, and I was talking to them about bolusing and their texting, and it just made sense to me to use texting to help give that message about medication adherence. The typical teen sends 50 texts a day. I believe recently the statistic was updated to 60 texts a day that a typical teen sends. And what's interesting about texting in teens is that the demographic divide for financial, you look at the bottom with household incomes less than $30,000 a year, which is defined as poverty. About 60% of teenagers have a mobile phone, and greater than $75,000 income, about 87% of teenagers have a mobile phone and text. And actually, a lot of parents have a different cell phone plan than than their children. And in fact, their children tend to have an unlimited texting plan versus their parents that have a limited texting plan. And what's really interesting, too, is that a lot of people are using phones in the Hispanic community, which is really affected by diabetes, as one of the primary ways to get on the internet, and they're one of the highest texting groups. So it made sense to me as a researcher as well as a doctor to hypothesize that weekly friendly nagging is what I call it, but a fancier way is saying personalized interactive engagement, texting my patients once a week, that I thought that would increase their mindfulness for pressing that button. So what I did was pretty simple, but I standardized it. I would say basically the same thing each week at Thursday at 5 o'clock, and the parents agreed to consent to do this, and the teenager said, yes, I'll always be available at 5 o'clock for 3 months. So I said, hi, this is Dr. Dyer, and then I would give them a personal aspect because of all the complicated reasons that medication adherence is a problem for people with diabetes. I wanted to make it personal. So I asked them questions about their life. So I would ask, well, are you excited about prom, or how's lacrosse? Something that I would typically ask based on our doctor-patient relationship. And then I would nag them like, oh, how are you doing with your boluses? How are your blood sugars? And then I would conclude with an inspiring message, keep up the good work, or if you had a bad week, I know you can do better next week. So that was the extent of the conversations. And what we found is that actually the hemoglobin A1C of the first 3 patients that were part of the texting study, they started out at the 10 to 11 range, which is indicative of not pressing that button. And they weren't in the hospital because they were getting their basal insulin. But then at the end of the 3-month period of this friendly nagging, their hemoglobin A1Cs dropped to the 8 to 9% range. And their adherence to pressing the button dramatically changed. So I actually on Twitter said, oh, I'm so excited whenever I saw these patients. And then a medical student said, hey, I'll help you code to make an app to automate the protocol. So what we did is we used external internet services and PHP programming, if this, then that, and we automated the protocol. So I'll just show you we didn't release this app, and I'll tell you why in a minute, but this is the way it would work. Only the doctor would need to have the app and need to have a smartphone, and the patient would only need to have a phone that receives text. The doctor would enter the personal aspect information, which is why I thought that it worked. and would add it to each patient, kind of the way that you add contacts. So we'll use Nick Jonas as an example because he's a pop star that has type 1 diabetes. And what social cues, basically, I would enter 10 different things every 3 months about my patient that's special about them. So Nick Jonas likes music, and he loves Frappuccinos, according to Teen Beat. So with this program, whenever I'm finished entering things, then it would send out a message to Nick, and he would say something cool, thanks, Dr. Dyer, keep rocking. And all the messages are automated with PHP programming, so all of the cues that I put in get turned into a sentence. And so I can send out multiple texts to multiple people. It's all automated. So basically, I can add as many patients to this as I want as the doctor, and then every Thursday at 5 o'clock, all I have to do is send queued messages. And so a queued message would look a little bit like this. So it's Thursday, 5 o'clock. Nick is putting some gas in his car. Dr. Dyer here, hope work on the new album is going well, because I put that in as music. And then maybe it's Thursday, 5 o'clock. Nick, hope the carb counting's going well. I know you like Frappuccinos. And also, then he's at a concert. Keep rocking the boluses, Nick. See you in a few weeks. These are all my speech patterns, so the PHP programming could be specific to anybody's speech patterns. But what's interesting, and the reason I didn't release this app, is because my patients that I kept texting past the first 3 months actually stopped pushing that button again. And I asked, what's going on? And they said, well, Dr. Dyer, we really like it when you text us once a week, but we really need more. Sometimes I just forget. And so I need more reminders, and I just don't want to have diabetes. I need more motivation, and sometimes I just need more support. My parents are nagging me, and they don't really understand how much work it is. So enter eProximity and Duet Health, a mobile software startup in Columbus, Ohio, in my town. So they said, well, we can help you program a new app that would work better. So the Endo Goddess App is that new app. And the hypothesis and design is evidence-based. So it's based on targeting and engagement behavior, which is glucose checking. So instead of pressing the button, I thought I would target a harder and more measurable behavior, which is glucose checking. Because in my experience in practice, it's the glucose checking that is the first thing to go with bad habits with diabetes. And people may keep pressing that button, but not check their blood sugars, and it just is a first indicator in my anecdotal experience. So that's why the target behavior is checking blood sugars. And based on BJ Fogg's health behavior model, the technology needs to motivate, educate, and trigger, and this will help improve medication adherence by targeting this behavior. So what I mean is that a technology that motivates you to do a behavior, that triggers you to and reminds you to do a behavior, and that empowers you with information to do a behavior is what a technology needs to do. It needs to do all three things. And perhaps the reason that my texting didn't work is because it was just the reminder. It wasn't any of the other factors. So literacy or ability is giving the mobile phone the power to give you the information without searching that you would like, frequently used links, how-to videos that apply to the behavior. Triggering would be push notifications, email notifications, any alarms, and basically reminding you on a more frequent basis than once a week. And motivating as well, using game mechanics, competition, and social, because my patients are never going to want to have diabetes. So I need to motivate them in a different way than ever expecting them to want to have diabetes. So I took a leap of faith, and I left practice and helped with my amateur coding with Duet Health, and we made an app together. We started with the Apple platform and then also translated it to the Android platform. And it was a really exciting day when it was released in the Apple Store. So it's called the Endo Goddess App after my Twitter tag. And the reason that we chose iOS and and Android platforms is because the BlackBerry platform and RIM is going by the wayside, but it's about 50-50 basically in the United States. So what the journal, or what the app does, is that it's a glucose journal, and it, again, we're talking about blood sugar checking behavior. So what it does when you check the blood sugar is that you get points. And whenever you get a certain amount of points, you can cash those points in for rewards and with iTunes download. What's really interesting is that we have a social business model as part of offering support. So a patient would get their father or their mother or their boyfriend or girlfriend to help support them. And what the app would do is send out a link for email, and then that person can put money into the iTunes account. And that's the social business model and the accountability that goes with the checking of blood sugars. And the EndoGoddess app triggers, and it does the reminders, as pointed out with BJ Fogg's health behavior model. And it also provides literacy, and unique to the EndoGoddess app is talking about all the information for patients to get involved in social media. So Twitter chats, what time they're on, and anything, favorite blogs, some really great prolific advocates. So when we first released the app, which was in the fall of 2011, there was a study in the Journal of Medical Internet Research that looked at how many diabetes apps are out there. And at the time that we released it, there were 358. And whenever you look at what all of those apps do, most of them provide basically insulin medication information, and also very rarely provide any social media information. So what is the future? Thinking about doing a randomized controlled trial, making a kids version, partnering with medical devices so that there's seamless integration, partnering to get test strips instead of iTunes, EMR integration as well, or perhaps advertisements, because our users are very engaged whenever they're opening the app multiple times a day. I'd also like to point out that some studies that I'd like to be doing in the future is using a patient activation measure. I think it's a really good measure for mobile health about how you can actually improve health quality. I think it would correlate very directly. And device data integration, we recently just were able to integrate the EndoGoddess app with the IBG Star, but we haven't released that for regulation reasons. And whenever you talk about the cost of healthcare, I think it provides opportunities, the challenge. And the Affordable Care Act really actually tells us that there are some great opportunities right now. And this is from the slides from the federal government about specifically what they're doing. Creating new incentives with the Affordable Care Act, information, big data, and this is rocket fuel for innovation. So the new incentives are meaningful use for electronic medical records, but mostly paying for quality care instead of volume care. And population data aggregation and the release of big data. For instance, integrating data with GPS onto an asthma inhaler so that you can really see the patterns of where you use your asthma inhaler is a great example of what the government is trying to sponsor new projects. There are also challenges that are going on in codeathons. I went last year to a DC codeathon, and what people do is get together on a Saturday and essentially create some new programs. But I'm also, one of the winners is here on Twitter, Maya Food Oasis. And also in this space, there are accelerators and VCs that are really excited to investigate Rock Health as one, Startup Health. And a new idea that I'm going to be premiering for you is I'm going to be putting a video on Kickstarter to try to raise money for a clinical trial for the app. So without further ado, I'm going to show you the video that I made last week, and it will be on the site on June 1st. Do you know anyone with diabetes, or do you have diabetes yourself? Well, I'm Dr. Jen Dyer. I'm an endocrinologist, a diabetes doctor, and I know diabetes sucks. But together with a startup here in Columbus, Ohio, Duet Health, I've made an app to make diabetes a little easier. We've invested our own resources to take it to the level that it's at, which is released in the App Store on Apple and on Android. And it's gotten international and national acclaim for its innovative design. But we need to take it to the next level, which is making some more edits, getting some of the bugs out of the technical aspect of the app, making it as special as we know that it is. It provides a journal for people with diabetes to write down their blood sugars. Now that's not special, but what's special about it is getting reward points. So every time you do check your blood sugar and enter it into the app, you get a point. And eventually you can cash in those points to get an iTunes download. Who doesn't want music? In order for doctors and insurance companies to prescribe this app for you to use, and for you to get the credit that you deserve, and for the app to work the way it should, we need a clinical trial that proves that the app makes people healthier, just like I know it will. And your funds will help with that. You'll be directly involved with making this clinical study happen, execute, and be published so that all the results can be shared. You're making history by being on the site, by funding things that you think are important. We need to have a clinical trial that proves that having fun, playing games, playing with your app makes you healthier. Let's make diabetes easier by proving that the Endo Goddess app makes you healthier.